Right now, let's shift the focus to doctor recruitment. It's been a busy time in that regard, with a new doctor coming to Port Hawkesbury to start his practice. But by the same token, the absence of a doctor at a Richmond County healthcare facility has impacted that facility's ability to carry out various aspects of its business regarding healthcare for residents across the county and beyond. The issue came up at Richmond Municipal Council's recent meeting of its Committee of the Whole. So let's go there right now to tell you about how an absence of a doctor at the Kingston Medical Centre in Lordways is making an impact all the way across the county and landing at the council table in Arishat.
The discussion at last week's Committee of the Whole meeting began with a few words from District 5 Councillor Brent Sampson, whose constituency includes the Kingston Health Clinic. Sampson told the Committee of the Whole meeting that the health centre's mandate extends far beyond seeing patients for medical reasons.
It's a lot more than simply the clinic, let's say. It is the community health centre. They've been doing a lot of work in administering several grants over the last number of years. There's several grants that are being administered at the moment. If they were to end up in a position where it had to shut down for some point in time, not only would be, looking at the half a dozen people are still employed there, but also it would kind of may put into jeopardy some of the administration of these grants that are being handled by them right now. So it's hard to understate the importance of, this health center to the county as a whole. We've had Michelle in here from the Senior Safety Coordinator. That's, much of what she does is administered through there. There's several, the Cape Breton South Recruiting for Health group is a partnership somewhat administered through that.
To help drive these points home, Sampson got Council's permission to invite the board chair for the Dr. Kingston Memorial Health Clinic, Juanita Mumberket, to approach the council table in Arishat.
We were, I would think, instrumental in getting the Cape Breton South Recruiting for Health organization started and working all of the angles that organization has been working towards. We have also been, we reached out to Mike Kellaway, early in the game to say what could happen there. We've reached out a few times to NSHA and the Department of Health and Wellness to look for innovative solutions there. We're still working with them to try to find a different solution for our organization. We're also a member of the Nova Scotia Association of Community Health Centres, and there are some interesting funding models for a couple of the other community health centers in the province. So we're trying to discuss that with the Nova Scotia Health Authority. We also do have a few infrequent renters who come in to do some other types of health services from our building, and we always try to offer that because we do have a little bit of space that we could offer. We have been recently getting some requests about renting space in the building, so we have those requests and we're providing information back and forth to some of these other groups.
Mumberket also took the opportunity to remind Richmond councillors how difficult the Kingston Health Centre situation has been since losing a physician just about a year ago.
So each physician that we have currently, our current rate that we charge them is $3,000 a month.
Okay.
So that revenue that we have lost is just that much. There's a much larger budget that we have to operate the building, to have the staff, to have the all the maintenance of the building, etc. So that's just $3,000 for that one physician that we're missing. And we have been missing since March, maybe last year. She left mid-March. Yeah, around now, I guess.
A podiatrist there every second Monday, and currently they have provided rental information to continuing care and circles of support and change, waiting to hear from the parties in that case. But there has been other efforts made besides simply recruiting a physician, to get rental revenue as well.
The reach of your non-clinical programming is over 1,700 people across all the county, just in this past year.
Correct. Yep.
since you started doing grants, it's over 30 grants, 6 privately funded projects, resulting in about 1.1 million in investment in the last 4 years.
It's also a community building that was a lot of fundraising. It brought the community together when they built that building. So it's very personal, I think, to the local community, while it still supports the broader community.
It's incumbent on us to try and figure out some kind of a way to move forward on this. I know they're not looking for this to be long-term. They've been working with the province to try and come up with some creative solutions here moving forward. It's just that without having a second physician there for about a year or so now, it's created a financial shortfall that now it's getting to a point where something has to be done.
With some prompting from Councillor Sampson and Warden Amanda Mumberket, the Kingston Health Centre's board chair went on to confirm that her organization is hoping for a $3,000 payment to be able to allow the facility to maintain its expenses for just the coming month. However, Juanita Mumberket suggested that the situation could become more dire in the months to come without immediate emergency funding.
I know $3,000 is the cost of the doctor, I guess, that's gone, or the rent, I guess, more or less you would cover. Is there anything else, is there anything else that's been in place for if the doctor cannot be replaced at any short time? Or is there anything else in the, in the broad future, if you can't find a doctor to replace them, to fill that void for the, financial?
We were without about $30,000 last year. So where did that money come from? That came from our fund that will maintain the building, that the community donated, that we have as a chunk of money to keep for the roof, or to, if whatever happens, the furnace blows up or something, that's that chunk of money. So we're steadily eating into that. So that's, and we're at the point where we're worried about taking on more grant work, because if the horrible side does happen, then we can't administer it. So we've actually kind of slowed down going after grant money, which is a shame
that's a concern
in the current environment, especially with the people who are ready to volunteer.
While councillors were all willing to consider emergency funding for the Kingston Health Centre, the seriousness of the situation emerged shortly after District 3 councillor Melanie Sampson stressed the need for due diligence on the municipality's part to make sure that $3,000 worth of emergency funding could be met within the framework for the upcoming municipal budget. That brought out a nervous reaction from the Kingston Health Centre's board chair.
I'm not sure that my board will be happy if I don't go after the $3,000 for this month. Is there any way we could change that to say, can you give us emergency funding for, March, and then do the deliberations and the discussions?
However, council officials clarified that they were voting to send the recommendation for emergency funding from this Committee of the Whole meeting to the next regular meeting of Richmond Municipal Council, coming up this coming Monday evening. At the same time, Council will also instruct staff to take a look at whether further funding for the Kingston Health Centre can fit within budgetary discussions that will take place within the coming days.
I would have no problem entertaining a motion to, if the emergency funding is to, we're only talking, and I know I say only, but we're talking $3,000 to hold them over to a budget deliberation. So, again, I'm sure that somewhere in our current budget we can find $3,000. So I would have no problem making that motion to move forward with